Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to take a few minutes and talk about a new device that it's exciting. It's not a new technology, but a new device that's really refined and much improved some older technology called the Silhouette Lift or the Silhouette Instant Lift, which uses a thread or suture technique, and it's a special design to create lifting by placing the device in the under the skin, the subcutaneous tissues, and elevating the tissues in a way that is long-lasting but not permanent. The suture itself dissolves over time with the Silhouette Instant Lift. And I want to make this distinction because many of us remember the era of what was called the barbed thread lift, and there were many names for this, feather lift, etc. And these little barbed sutures were placed, many of them, below the skin surface in a similar fashion. And it was the barbs, when they were placed in a certain direction, that retarded the skin or kept the skin from falling back down. And what we learned was the effect of this was very short-lived. At 3 or 4 months, the benefit of the barbed sutures that were placed were gone, really, and there was very little benefit for the cost. The Silhouette Lift, or the Instant Lift procedure that's by Sinclair Pharma Company, actually is a series of small PLGA, which is an absorbable suture-like material. In fact, it is a material for many sutures that has in it a series of cones that are directional. When the device is placed using a special needle below the skin surface, those little tiny cones are threaded up underneath the skin of the face in a series of passes, 1 or 2 usually per side. And once they're placed, the skin is elevated, and the cone formation keeps the skin elevated and keeps it from falling back down. The little thread is clipped at the entry and exit points, just a very small puncture type of incision, and the sustained elevation of the skin is then achieved by the formation of collagen that replaces the suture over time. So that procedure is very different than what we had seen in the past with the so-called thread lifts, and something that we are hoping to see 2 or 3 year results with for people. Certainly not a permanent correction. It's not a replacement for a lower facelift or a full facelift in those patients who want an enduring type of procedure. But for someone that wants a small but appreciable lift, this is an area where suture lifting might be a benefit to you. There's been a few other devices that are similar, one that I've described historically, that are specifically designed for the cheek fat pad using a different type of suture. And I think this one in particular is beneficial in elevating the jowl area and the mid-face zone, and it can be a real complement or supplement to using volumizing type of fillers. What I'm seeing now, and I think the trend is very common, is people are massively overfilled to try to get a lifting effect, and by using and the main reason is they don't want to have surgery, and that's understandable if people are not ready or prepared, either emotionally or financially or for other reasons, to do a lifting procedure. I understand, and we certainly know that some volume is needed with aging, the replacement of the lost volume. So I understand the rationale behind not wanting to have surgery. But the concept of using fillers to try to truly lift someone is really not the best direction to go. And in minimally invasive procedures, the Silhouette Instant Lift is the common term for it now, may provide a really good alternative for lifting, while we can also supplement that with soft tissue augmentation using injectable fillers. There are other lifting devices that do a minimal approach against stimulating collagen, such as Ultherapy. And so now we have a few tools. Ultherapy, which uses ultrasound and focused energy. We have the Silhouette Instant Lift, which is a newer device. It's been in Europe for many years, and it's been refined here in this country. But I think that these additions, minimally invasive approaches that may not have permanent duration but are lasting or enduring improvement, really are something that patients are looking for, and that I feel are safe when they are dissolvable, like the design with the PLGA design that we see with Silhouette. If you have any questions about the Silhouette InstaLift, procedures in general to lift the face that are minimally invasive or even surgical, please don't hesitate to call or write. If you have any experiences with these or questions that you'd like to ask about your experience, also please don't hesitate to contact me. You can send pictures or even videos if you want of yourself, and I'll be happy to comment on them publicly or privately. As always, it's my pleasure. This is Dr. Corey Maas on Looking Your Best.